So today's presentation will focus on 5 things: the state of the state, the elections and the legislature, the fiscal context that all of this comes out of, the New York State budget, and then I'd like to hopefully have a conversation about advocacy. So the state of the state is not news to anybody. We're in the middle of a recession. We're not going to get out of it anytime soon. We have a new governor, he has new staff, he has new priorities, and there are a number of new relationships that we at Schuyler and you folks as well will have to have with this new administration. So a lot of the low-hanging fruit has already been cut. The last couple of years saw significant increases in human services funding, and we're going to see more. On the flip side, and ironically, the programs that meet the needs of the most vulnerable are needed more than ever. These are some interesting statistics. 79% of New Yorkers say that they only believe that their elected officials are going to do what's right some of the time or not at all. And yet Governor Cuomo has a 77% approval rating. It'll be interesting to see how that we're being recorded, so I won't keep it on. The budget has passed on time only 6 times since 1975. I was there for 2 of those years, and they were very exciting. I do believe that this budget will pass on or around April 1st. 59% of voters are optimistic that Governor Cuomo will solve all of our budget woes, which seems very overly optimistic, and I have a lot of pressure for him. So I think that we didn't get into this mess overnight, and we're not gonna get out of it overnight, no matter who is governor of the state. So we just came through the elections in November of 2010. Obviously, we have a new governor, a new lieutenant governor, Robert Duffy, who's from Rochester, and a number of new agency heads, although I would say that some of the agencies that folks in this room work with the most and care about the most have not had their commissioners either appointed or reappointed. So there is a new commissioner of the Department of Health, but we're still waiting to see what's going to happen at the Office of Children and Family Services, at the Office of Temporary Disability Assistance. So we're waiting on that, which makes negotiating the budget and advocating for things really difficult when you don't know who to talk to. I would say also that in the governor's office on the 2nd floor of the Capitol, we don't have anyone appointed as a deputy secretary for education, so there's no one to talk to there. Kristen Proud still serves as the human services contact there, so we've been working with her, but people's jobs are still kind of up in the air. And with most administrations, in my experience at the National Governors Association, we always said don't get too close to the people who are serving from January to April, because they're generally campaign staff and they're going to flip over in April. So I'm hoping that we'll get some people appointed on the 2nd floor, but right now it's just a really kind of strange time and confusing time when you're going to advocate and you're not sure who to talk to. The New York State Assembly has had a Democratic majority for years and years. I don't see that changing anytime soon. The New York State Senate, the Republicans regained the majority after 2 years of Democratic control. And in Congress, as you know, the Democrats retained the majority, and in the House, the Republicans retained the majority. This is kind of just 101. The New York State Legislature obviously is composed of 2 bodies, the Senate and the Assembly. They're elected for 2-year terms. There's no sort of time limit. You can serve forever. Each year we see 17,000 bills introduced. That's a lot of stuff, and a lot of it happens after the budget is passed in April. They meet until June, sometimes longer. The fiscal context. $315 billion deficit. The comptroller actually puts that closer to $1 billion. There's some evidence of recovery, but I would say that that's state revenues are still lagging, and we're still seeing a lot of catch up. The state general fund deficit is $9 billion. Again, the comptroller says that's a little higher. We generally are working under the assumption that there's a $10 billion budget gap in the general fund that needs to be filled somehow. Again, many cuts have already been made over the last couple of years. And in case you didn't know, 75% of the state's operating funds go to just 3 places. We're talking about Medicaid, salaries and benefits, and school aid. And obviously during the recession, unemployment rises, more people need income and other supports at the same time, and state revenues fall. The fiscal year begins April 1st, ends March 31st, hence the budget should be passed April 1st. Budgetary responsibility lies with the governor. He got his budget out, his first executive budget out April 1st. It usually comes out in January because he was new. He gets another couple of weeks, so he released it February 1st. The legislature then has about 2 months to debate it and negotiate it, but the governor does have veto power, so he can veto any spending that the legislature adds. Now I'm going to get into Schuyler Center's budget priorities, which I think will resonate with folks here. And if anybody needs any more information on any of these, because I'm just going to do kind of a quick and dirty, just let me know. The first thing that we're really, really concerned about is this governor's proposal of a new, what he's calling a primary prevention incentive program. What it does is it takes a number of prevention programs and lumps them into a block grant. They are disparate programs, meaning that they serve different populations. So there's funding for home visiting in there, there's funding for kinship care, there's funding for runaway and homeless youth. So, you know, we're pitting programs that serve little kids against programs that serve other populations, older youth. The funding is halved going into the block grant, and then it's made competitive. So counties will apply for funding, and they'll have to pony up a 38% match as well. And as we know, counties don't have that kind of match fund money. A lot of these prevention programs didn't require a match up until this point, so that would be something new. So we're really concerned about the PPIP. We're opposed to the PPIP and are asking the legislature to reject it. We have also kind of prioritized programs that are in the PPIP, and I would say that home visiting is the first. That would be funding for Healthy Families New York, funding out of Community Optional Preventive Services, or COPS, and funding out of the Healthy Family Trust Fund, which all pays for Nurse Family Partnership, Parent-Child Home, and Healthy Families. But, yeah.
You had said that under this block grant, the counties would have to come up with a match. I know some of the programs that you mentioned are not funded to the counties currently. They're funded directly to the agencies. So is this now a combination of programs that the county receives funds and then disperses to agencies, as well as those that go directly to agencies? And then if such, would the agencies also be required to have the 38% match?
That's a really good question. I'm not sure one that I can answer right off the top of my head. I can definitely get back to you. Our understanding is, and I honestly think that Division of Budget in the Governor's Office is still kind of fleshing out how it would work. But our understanding is that the money from now on would go to the counties, like I said, on a competitive basis. So there would be an RFP issued. Counties would, you know, if they work with an agency, we have talked to some folks about the 38% match maybe being a mix of public and private funds. So if the United Way wanted to put in some money, maybe that would be a way for them to do it. We want them to reject the thing outright.
Because no one thought about the fact that if they want now to send their money to counties, counties now have a level of administration that they didn't have, particularly for those programs they didn't previously fund.
Exactly, and one of the things that we've been talking about specifically with the Healthy Families New York home visiting program is that even if a county decides that that's what they want to fund, they're not going to be able to fund the administration and the infrastructure. So you go from having an evidence-based program to having something that's kind of just, you know, whatever the county can cobble together. So, probably an idea. Another proposal that we are opposing is the delay in the third phase of the public assistance grant increase. This increase was agreed upon a couple of years ago. The 2009-2010 executive budget provided an increase of 30% to be implemented over a 3-year time period. So 10% a year through July 2011. But now when people need public assistance more than ever, we're going to delay it. This is an interesting one. It incorporates the full family sanction to strengthen compliance with public assistance work requirements. So right now, if an adult misses an appointment or a work opportunity, they lose their benefits and the children continue to receive benefits. And we're not talking they missed, a work requirement once. There is a, what this would do is change the law so that we deny children benefits as well.
Oh my God.
I'm just the messenger. From the large crowd. TANF, temporary assistance for needy families. Anything that receives TANF is eliminated. Funding is eliminated. It's $200 million, except for childcare and the flexible fund for family services, but childcare has its own issues. These funds, as you know, are used for folks at risk of becoming homeless, people moving from other to work. So again, a pretty hefty decrease here. Kinship guardianship, grandparents, aunts and uncles taking care of kids instead of allowing those kids to be placed into the foster system, not funded.
Oh, wow.
So again, we're trying to keep kids out of the child welfare system, but we're not actually hoping that to happen. We are pretty excited about the reforms to the juvenile justice system, and these are reforms that, in part at least, came about because the U.S. Department of Justice came in a year or two ago and found that we weren't doing what we needed to do at the state, and that kids were being housed in places that were certainly not going to be helpful to them. So, and this is very small print, so I can send this around to folks, but it aims to shift practice toward community-based treatment and reduce capacity by 31%. So we are certainly in favor of community-based treatment. We're very happy with that. We're interested to see, and certainly will be involved in how that actually happens, to make sure that that doesn't happen, or that it does happen, and that we're not doing, what we did a number of years ago with mental health institutions and basically didn't provide services for folks. Something that I should note with this is the Commissioner of Office of Children and Family Services, Gladys Carrion, who has been a pretty controversial figure, but has certainly been at the forefront of closing the facilities, has not been reappointed yet. She is still in her position, but awaiting word. So I'm not sure where that's going to go. Excuse me. There's a lot of talk, and actually a task force right now that's talking about consolidating agencies. And OCFS, OTDA, OASIS, OMH are all in that pool of possible consolidation. This is the SCR clearance fee, which if you work in a child care center, say, you would have been exempt up until this point from paying this fee, which is basically a background check. It's $5 now. The administration wants to raise it to $60. I think I heard yesterday that this would result in a revenue of $12 million for the state. We see it as raising revenue on the backs of the lowest income people. Medicaid redesign team just came through with dozens of proposals that are now in the budget. One of those is to increase co-payment amounts for Medicaid fee-for-service and Family Health Plus to require co-payments for Child Health Plus. The big one probably is to make sure that every Medicaid member is enrolled in managed care. These proposals are only good for a year. None of this is going to happen in a year. It's certainly going to take a lot longer than that. I would say that there's some opposition to certain of these proposals. We're pretty happy with most of them, but we're taking a really good look at exactly what they would mean and how they would be implemented. So a lot of what we do at SCAA is advocacy and education. We spend a lot of time working with policymakers to get them up to speed on issues. You certainly cannot expect a legislator to come in and have a handle on every single issue out there. So we like to offer our services to serve as a resource to them. We've actually met with Assemblywoman Pollin's office 2 or 3 times in the last 2 weeks, and we'd like to think that if she needs a question answered, she can pick up the phone and call us, and we will give her the most objective and data-driven information that we possibly can. And we do spend a lot of time advocating. I'm a registered lobbyist, so I've spent the last couple of weeks wandering the halls of the Capitol. I was there from 11 to 7 yesterday, and just kind of doing what we do, talking to people. We have heard some positive things from legislators who are unhappy with the executive budget, but what we also keep hearing is we need to find the money, and we'll see how that rolls out. One House bills come out the 15th, which I believe is next Tuesday. So that's an opportunity to see the Assembly's budget and the Senate's budget, and then they'll sit down and negotiate together and give something to the governor, and we'll see what happens then. Like I said, not overly optimistic about a number of things, but we're certainly working our butts off to see that some things change.
I know that this may be a really taboo subject. In addition to all the cuts that are being proposed to balance the budget, to make up for the deficit, and even the increase in that new surcharge for the quote-unquote background checks, that again, hit, as you said, the most vulnerable populations, as well as the organizations whose budgets have been cut already. Is anyone going to be brave enough to talk about increasing revenue from folks that have extra money to spend, or they don't even need it?
Tax. Yeah, people are starting to talk about it. And I think that there are some of us who are hopeful that that will be a proposal from at least one of the houses of the legislature. It's certainly been, I'm sure you've noticed the ad campaigns from NYSED and from Citizen Action that speak very specifically to a millionaire's tax. So we are hopeful. There are no other large revenue raisers, as far as I can tell, on the table. The soda tax is not something we're talking about like we have in years past. So we'll see what happens with the millionaire's tax.
Or at least call those other things they're doing taxes, so that they can then not lie to people that they're not raising taxes. But okay.
No fees. Karen, this is good. 2 things. First, in the Times today, there was a very interesting editorial about what the Connecticut governor has decided to do. And, obviously the circumstances of Connecticut, New York, New Jersey are all different, but it was very interesting because one of his approaches was to really put taxes on luxury items that only wealthy people could afford, which seemed to be very sensible. And I don't know if that's something that's being bandied about, but it was interesting food for thought.
Yeah.
Second thing is, how come we peons haven't gotten instructions from you folks up in Albany about what kinds of letters we should be sending to legislators?
Well, I think, and this is a great opportunity to get folks involved, Schuyler Center does do a newsletter called The Source that goes out to 1,000 people around the state, and we can certainly get folks on that. We have, we use it during kind of the off-season to talk about policy, but during budget, we definitely have kind of laid out our list of priorities. Winning Beginning New York also, if you're interested in issues from 0 to 5, has a big listserv and a big e-advocacy campaign. I send out, a message a couple of times a month asking for folks to do certain things. So I'm happy to, if anyone is interested in getting involved, we're certainly, I'm thrilled to be here today and kind of linking up with what Westchester Children's Association does.
So just so that you know, we will have Jen's PowerPoint available on our website. We can, for those emails that we have, we can send you the link to that we have her contact information as well. And, sort of the next thing on our agenda is really to talk as a coalition out of Westchester on what some of those priorities will be and whether we want to set up a letter or an email through, I know most of you here have used our voter voice where you can just sort of click in and an email can go to elected officials. And we were really waiting for this meeting today to see what priorities we could all agree on to sort of put that in motion. So, yes.
Allison, actually, Chris Dice, the Executive Director of Prevent Child Abuse New York, put together a lovely packet regarding advocacy for healthy families New York.
Okay.
I could share that as well with you, that information,
Great,
so I can
great.
share it after next.
Yeah, I mean, there is a lot of information. In fact, one of the packets that we had at the table is from Citizens Committee in New York City and their sort of packaging some of their priorities, as well as what Schuyler has. Children's Defense Fund has also done a pretty extensive analysis and has some information available. And as we get it, we just, sort of forward it out to people so that you can have the information from the different groups and constituents, and you begin to see where some of the consensus is on the issues. So other questions?
It sounds like in the logic of all of this, that an increase in foster care placements is somehow acceptable. Has anyone costed out what that is projected to be?
I don't know, that we certainly have not costed it out. I mean, one of the points that we're trying to make, and one of the things that the governor said in proposing the establishment of that PPIP block grant, was that it would prevent child care placements and placements into juvenile justice. We know that's not true.
And
so a lot of our
50% of what
messaging
it
has
has
been around, I'm sure you have the best of intentions, however, this would have the complete opposite impact. So we've certainly been messaging around, this is not going to do what you say you want to do.
Howard, do you have a question?
I want to mention that on the 30th, Westchester Early Childhood Directors Association and I believe the Infant and Toddler Network will be going up to Albany. We have a bus that is going to be leaving, and we're going to have a pickup in White Plains. So if anybody wants to join us in terms of children's issues and support the Winning Beginning agenda, we would be very glad to have you join us.
Yeah, thank you, Howard, because I totally think on that. We're doing Winning Beginning Wednesdays, which is every Wednesday in the month. We have a different region come up. Next Wednesday is New York City, and the Wednesday after that is Westchester and Rockland. So if folks are interested in doing that, we're making representative visits with local representatives and also with leaders of the chairs of our relevant committees.
Talk about there's rumor about consolidating agencies. What kind of effects do you think this will have?
Well, I think it depends on really what happens. I see this all the time. The new administration comes in and they consolidate all the agencies, and 8 years later another administration comes in and takes them all apart. I do think that there's a good deal of waste and duplication in some of our agencies, so I don't necessarily think that it's a bad thing. I think it will be interesting to see how it's done. Commissioner Mike Hogan at OMH has been reappointed, so he's staying. But like I said, we don't know about OCFS or OTDA. There is someone new at OASIS, and I'm blanking on what her name is, but she actually has done a good deal of consolidation work. So we think that she will probably be tasked with some of that. Kate Breslin, who's our executive director, had an interview yesterday with the SAGE group of folks, which is the task force that the governor has put together to talk about consolidation. And some of the questions that were being asked were, what do you think that such and such an agency could do better? Where do you see the duplication? So they are looking for outside input as they go about doing this, but like I said, consolidation doesn't happen overnight, and it's not easy, and it will result, I would think, in state worker layoffs. So hopefully not at the risk of serving children and families, but I think it remains to be seen, and it's not anything that's going to happen overnight.
Years ago, SCAA, which was then had a different name, was
We kept the acronym.
right, was pushing the idea of a children's agency. And I wonder if that has come up at all. If they're thinking of reorganizing, is that something that anybody's taking up and looking at?
Yeah, when I, 4 years ago when Governor Spitzer came in, he talked about a children's cabinet, and I had done a great deal of work at the National Governors Association on children's cabinets, so we worked pretty closely with his administration on getting one up and running, and then lo and behold, the Council on Children and Families, which is under OCFS, and it kind of been pushed to the back during the Pataki administration, came forward and said, well, we thought we were the children's cabinet. We just haven't really functioned in that capacity. So there are conversations now about how to make that work better. That we have an existing Council on Children and Families, it's a state agency, and that's actually, they staff probably 2/3 of the Early Childhood Advisory Council, and Schuyler Center comes in and staffs the other third, so that there's a public-private partnership. But there's been a lot of conversation about how to make that and the existing, Spitzer Children's Cabinet kind of work a little better together. The Children's Cabinet that Governor Spitzer created took on 2 issues, pre-K and children's health insurance, and basically did their work on those 2 issues, and then, didn't disband, but didn't do much of anything else. And then disconnected youth became one of the issues that they took on. It remains to be seen how Governor Cuomo wants to use the Children's Cabinet, or the Early Childhood Advisory Council for that matter. We haven't really had any sort of communication from we honestly haven't had a lot of communication from the administration on children's issues. So, there's a lot of focus right now on insurance, on transportation, on economic development is a really big one.
I guess I was talking about something more radical.
No,
Actually, a new agency that would
a new
pull
agency.
parts of OCFS, parts of, well, that's what OCFS was supposed to do out of OTDA, but
Yeah.
it's only a little piece. We have mental health, we have education, all that stuff, which is.
Well, and we had talked at one point about a children's czar, somebody that would have that job. We haven't recently talked about that too much. I think at Schuyler we've been focused very much on the budget cuts. When we have a little time to breathe, we may revisit that. But it'll, again, something like that will depend on the agency consolidation too, and who's actually doing which piece of what. There hasn't necessarily been a lot of press about these cuts, so I'm not sure that folks are really aware of how deep they affect children and families, and also, if we make these cuts now, 5 years ago, when the state turns around a little bit, knock on wood, we're going to have more kids who we've already lost ground with, kids who need remediation services and kids going into child welfare and people going back on welfare. So, one thing that's endlessly frustrating about the state is that, and New York isn't alone in this, is that the funding is siloed. So when I go into a meeting and I talk about how home visiting can prevent low-weight births and therefore save $2.4 million a year in Medicaid costs, what I hear is that money doesn't go back to OCFS. It would be a savings for DOH. So it's not necessarily relevant. That's, that's how we look. And state ed is an autonomous entity. So, I would love to see all the agencies working very closely together. But I do think that framing a message that incorporates how it impacts education makes sense. Well, one thing that we've been messaging is that the governor's budget is just very short-sighted.
Yes.
That, this may be great for this next year, but, it's not going to be great for a number of people. But it's certainly not going to be great 5 years down the road.
So we had this great advocacy at the county level. Do you all remember 2010? And we got a lot of money put back in. The legislators overrode most of Astorino's vetoes of additional money, which was great. However, it's not being spent. And we're now in a situation, the last time I remember this was 1994, with Campaign for Kids, and O'Rourke didn't spend the money, so we're right back there. So I think we should first of all, we should let our county legislators know that this is happening. I know that in Invest in Kids, some of the programs that were completely cut have been restored or been reinvigorated, but all the programs that were cut 7 to 9% are still cut 7 to 9%. For what reason? I have no idea. Just to say we can. That is what's happening, and that's really not right. I know in child care that Title 20 is still not being accepted. Title 20 applications are still not being accepted. The paperwork to lower the parent share has not been filed. It's not happening. So that is not good. And we, I think we'll get something out to everybody that of what the situation is, and then again, we need people to, we'll tell you what to do, you know, call or email your legislator, let them know, and let's email Astorino, because this is happening like as if it's nothing, like it's behind closed doors. But it goes back to, and I was at a breakfast last week, Ken Jenkins and Peter Harcum and Jim Maizano spoke at the County Association, and Ken said, listen, we the legislators are willing to go before a judge and have the judge decide who can decide on this budget, because right now it's like a ping pong ball going back and forth. He said this, they said this, and everybody's interpreting the charter, but we have to know what the deal is, because somebody has to make a decision. And it can't just be continuously fighting. Do you want to say anything else about that, Alfreda?
Well, only that I agree with you wholeheartedly, and one of the big things was I was interested to hear that our new social service commissioner indicated that he hadn't restored the 5% for the parent share
Right.
of the Title 20 money,
Right.
and because he didn't think it was a priority.
So there you have it.
I think we should have a play-in, Cora.
A play-in.
Let's bring all the kids to the county legislator building.
Yeah, not to them, to us.
And up to them, and just say, look, we can't play in our daycare, so we're gonna come here and play. It'll get you your publicity.
Press, right. I'm happy to do that. I'm happy to participate in that. Yes, Howard?
What is the status of the lawsuit that was filed against the county executive last year?
Well, I think it's been joined by another lawsuit.
Yes, but
There-
where,
I
I
don't
mean-
know. Do you know?
Well, it's been about 6 months, so we're thinking that something's going to happen any day now. Enough time has passed, yeah.
It's still pending. There has not been a decision.
is there any way of moving or pushing the court? I mean, who has the power to move things forward
Just the
here?
judge. You know how judges are the judge, you know, they are not to be lobbied. We can't lobby a judge.
No, but I think we can possibly make some noise in terms of just questioning in the newspaper. You know, what is happening with the lawsuit?
That's fine.
And, you know, that might create an environment where someone would be interested in answering. Because there has been a lawsuit, and unless that's resolved, I think the county legislature is left fairly impotent. I mean,
And there's another lawsuit that's been filed around the Section 8 workers, because the funding for the 38 workers that were attached to the Section 8 contract that the county let go of, the funding for the workers has been restored, but the workers have not been rehired because there's no program anymore. And so the CSEA has filed a lawsuit. I know that the Board of Legislators is going to decide whether or not to join that, to say, you know, there's funding, you're supposed to hire us. So it's another lawsuit on exactly the same issue, which has to do with who has the authority to make a budget that has to be implemented. So there are legal issues, there's tactical issues, as Donna raises. I think there should be another discussion about whether we want to have that kind of demonstration, but I just wanted people to know that unfortunately the 2011 budget fight is not over and it's almost April. No, it's almost April. Yeah. So it's pretty crazy. And just as we were saying in terms of the state budget, once something is decided, when the implementation happens and what the changeover is such an unknown factor that it's all very abstract when you look at it on paper this way, but it's not abstract at all. It's families and kids and organizations and people's jobs, and very, very concrete when you come down to that. So that was the update on the county budget.
Okay, so we will stay tuned. I do want to thank Jenn O'Connor again for coming.
Could you talk a little online about the Medicaid redesigns and recommendations as they affect kids? Because
Sure.
they're pretty scary for any of us who are in the business of caring for medically fragile kids.
Yeah.
Especially.
Yeah, and I'm happy